Thank you very much. So I've got just a few slides to introduce Christine, who's actually not on video link, but she's a video. So I'll swiftly move on. Excuse me. So it's always an interesting question, and reflecting on, again, the last couple of days, I think we've got lots to learn from each other. But sometimes when we're all just clinicians together, we miss a trick. And working closely with business and analysts bring a certain spin to our view of the world and the opportunities we have to maybe translate what we're trying to do more effectively with commissioners. And Heidi's presentation earlier today was able to focus on the worth of working alongside people that are very, very different from us. So sometimes commissioners, they think that they've already got that service. Thank you, excellent, tick. And it's usually embedded in a very large community service contract. So I often hear this phrase, I think we got a service for that, it's all right, we're all right. So, and so just sort of putting a stick at a wound, hopefully we've got more to say than that. So what we need to do, again, when we're working with people that are not necessarily like us, but they still have a passion, actually, for improving lives, because that's their role, it is about finding a solution for them, because commissioners are charged with finding solutions. They have a limited pot, and they have to know that you are the solution for them. So how do you craft your story to make sure that you are a solution for them? So Accelerate has a very simple mission, and it's about making a tangible difference to people's lives for wounds and lymphedema. And Christine will talk about that. But from a commissioning perspective, from your trust perspective, whoever you're dealing with, the story is the same, and it may be more critical for some than others, but it is about actually how we manage our very scarce resources more carefully and with creativity. So we do need to understand what whoever you're talking to, their priorities are, and how you can create easy wins for your commissioners as well as your trust managers and the directors of the services, whoever it is. The challenge, of course, for commissioners now is that we can talk about investment. There is no investment anymore. And there's not, a few years ago, you might talk about, oh, that's an investor save program. Unfortunately, there are no investments anymore that's available for you to save. So you've got to be incredibly creative, and somehow you have to show some in-year savings or in-year progress. The fit to some of the priorities would be how you could fit within the frailty agenda. And interesting again, sorry to quote you again, Heidi, but you're within the frailty. So for those of you, this is a top tip for long-term plan, is how do you, in a community service, if that's where you are, fit into the local frailty work stream. It's very important, and it's about admission avoidance and helping people live better lives for longer. And so what's your winning formula? I'm sure you know what it is. It's about how you articulate it. And the good thing about, for me personally, working with someone like Christine, when you hear her, she's a force of nature, for those that don't know her. And so she's able to articulate, because she's come from a sales and farmer background. Interestingly enough, I have to say, she was also a teacher in her younger days. So, and she's worked with commissioning for a number of years in change theory and so on. So having someone like that has enabled me also to articulate better what we're trying to do. And so find someone like that. That would be my tip, is who can you find that would be aligned to your way of thinking, so that you can translate your fantastic clinical mission into something that's tangible and touchable for others. So the triple aim, how do you fit into the NHS triple aim? But I think also for those of you that are maybe lower down in the pecking order, the problem you may have is translating this to the key people, but then who is translating that to commissioners or to the directors? And it is a bit like Chinese whispers. I'm not sure that's a very good term, but you know what I mean, in that you tell someone something and they basically, there's a filter on everything. You know, we'll all have filters. So they may not quite get it, and then that gets taken on by someone else. They don't quite get it, and before you know it, it's just like, oh, they're asking for some money, you know, by the time you get someone. So somehow you've got to find out who is talking for you. How can you make it really simple so that the essentials don't get lost? And who do you need to get to buy into the audacious plan that you have for your service? But also identifying who you think is going to be a hindrance to that for whatever reason. And so you've got to make it simple. Because fundamentally, whatever your service is about, it is about improving lives and saying that what you're seeing isn't necessary and that there is a solution, that you actually have a solution, and you can articulate it in 3 easy steps. So we do need to be able to speak the same language. This is really important. And sometimes you've got to experiment with new ways of talking about your service to someone that is non-clinical. Get in front of someone who's non-clinical, even if it's like a member of your family, because trying to sort of create your story is really, really important. Oh, sorry, I didn't realise we were on clicks there. That was the last one. So what I was going to do, I'm hoping this works now, is that Christine O'Connor is our Business and Operations Director in Accelerate, and she's been videoed for this because she's in Antigua on holiday. So hopefully this will work. Do I have to do anything?
Hello everybody, and thank you, Alison. Your presentations and your perspectives remain as provocative as ever. A trait which I believe is much needed in this hugely challenging environment in which we all find ourselves. If there's one thing that is a no-brainer right now, it is that the status quo going forward is not an answer. So exactly where are we going in the context of this new long-term plan for the NHS? Let's consider. If someone was to ask you, what are the problems facing the NHS that this plan is designed to address, you would no doubt say 3 things: spiralling costs, increasing demand, and not enough capacity to deliver. Agree? If someone asked me that question 20 years ago, what problems are NHS plans and quality improvement trying to solve, guess what my answer would have been? Yeah, you've guessed right. Spiralling costs, increasing demand, and not enough capacity to deliver. So what's this telling us? Simply one thing, that despite all efforts, nothing truly changes. We merely, as they say, shift the deck chairs on the Titanic. From my perspective as a change agent who has witnessed many NHS plans, I have to say that this new plan gives me hope. The language, the determination, the proposed investment in primary and community care for the first time ever, all speak to a desire to really help change happen. The fact remains, however, that words on paper do not create change. Only actions and innovative people create change. And often, because no money is involved, and because, like Alison, they have a passion for wanting to make the lives of people who live and suffer with complex conditions, and in our case, with complex wounds, different. Change of this nature is a drive from within, and it's not about investment, and it's not about more money and services, but potentially it's about pushing the envelope and creating different ways of working because it matters to you. So my first real simple point is this. If a change you need and you want to make is important, quite frankly, you're going to do it. If it isn't, then it's simply going to fall right off your radar into the world of insignificance. So what's this got to do with the NHS long-term plan, I hear you say? Essentially, those with a will to make things different in the NHS will push the boundaries to achieve that. Those who have not got that will do what they've always done, and it will be business as usual. And guess what? In 5 years' time, if that happens, what will we be talking about at this conference in 2025? Yep, you've got it. The challenge of spiralling costs, increasing demand, and not enough capacity to deliver. So how do we get off this treadmill? And what on earth has this got to do with the topic I was asked to address? Let's deal with the topic first, as getting off the treadmill might actually emerge as a result of the conversation. My first question to Tina when she asked me to speak at this conference, and she asked me to speak about commissioning, was, can I share some ideas with you around how better to engage with commissioners? And my response to her was simply this: why do you want to do that? And my rationale for that response was quite simple. In the main, you do not liaise directly with commissioners. In most cases, the work you undertake is hidden as part of an enormous block contract held by your trust, which makes you a pretty small fish in a very large pond. No offence meant, but believe me, sometimes the facts hit hard. Commissioners may just be a red herring for you, but your own organisation may not, and it needs to be the focus of your ideas right at this time. So some really important questions for you to consider in relation specifically to your service area. How are wound care services run currently in your establishment? What's your role in that, your personal role? Are you the team? What's your relationship with community nursing and practice nursing like? Have you got any key performance indicators that you're held to account for? Or are they just bland numbers through the door? Have you got a budget allocated for your service? Do you know how much is spent in your specific area? What's your throughput? The fact is, there's probably a whole load more of questions that you can add to that list. But the message for you right now is that your focus to move things forward has to be within your own organisation. And that has to be your first port of call. And within that, of course, having some understanding of where your service could sit in the greater scheme of things, particularly when we get into the areas of frailty, multimorbidity, and areas where your service actually plays an integral role. The next question I'd ask you is, what do you want to do? What actually have you got as an idea? Or have you really got an audacious idea that will prove irresistible, not only to your employers, but also to the commissioners when they take it forward, because it's exciting and it's different? Is anybody asking you to come up with quality improvement initiatives? Do you know if there's a quality improvement strategy in your organisation and what the goals of that might be, and thus how your initiative might actually ingratiate the results? Like I said, a lot of questions to help you understand where to place whatever it is you may be wanting to achieve. How much do you really know about implementing a quality improvement initiative? We all talk about this a lot of the time, but actually when you come to put the pen onto the paper, do you know what you actually need to deliver to make it attractive? So in a nutshell, let me advise you that first of all, as I said to Tina, your first port of call has to be your own organisation and your understanding in regard to where you fit and what opportunities there are for you. And those opportunities, let me emphasize, are not about more of the same, but they are about doing something different and exciting. And I'm sure Alison's already shared loads of thought-provoking ideas with you that could become focus points for that work. So unless you've been told otherwise, I would park the drive to understand your commissioners. It's getting in your way. Just let the bigwigs in your organisation who do all the negotiations and let them just do all the work. Your job is to give them a meaningful big idea that you know will work and will deliver benefits. There's that word, benefits. Whatever you do, do not forget about the benefits. And think about Dragon's Den. The dragons want to know the benefits of investing their money in a potential new business. If there are not any realizable benefits, why would they do it? And the same applies to you. If there are not any tangible, realizable benefits, why is anybody going to listen and take on board your great idea? Oh, and on all of this, let's remember the issues we're trying to address. Yep, I'm sure you're saying it with me by now. Spiraling costs, increasing demand, and not enough capacity to deliver. Which brings me to the next really important point, that old chestnut leadership. Remember, you're not trying at this point in time to solve the problems of the world. You're trying to make a tangible and visible difference locally to a person, to a service, to a system, to work in relationships. And all of these things require you to pull hard on your personal leadership qualities and use them to your advantage. I'm not saying be pushy, but I am saying get yourself noticed for all the right reasons. Remember, leadership's not a qualification. You don't do an exam to become a good leader. It's in each one of us. It's inside. And for you guys, it's inside waiting to get out. Even if you're not looking for the big recognition, but you'd like to make a small step change, how about considering the skills needed to really engage in shared decision making with your patients and do that from the outset? And in that context, establish what outcomes they want from engaging with you. It's likely that their outcomes may not be directly clinical, but that your intervention, your clinical intervention, will deliver that outcome for them. Think about your technique with your patients and consider the art of motivational interviewing. Write that down. Personal note, must find out more about this. Go on, write it down now, because you should. Because this brings a whole different route of development for you and your patient in their relationship. And it gets them on the road to self-awareness, and it gets them on the road to supported self-management. Now let's go to the long-term plan, that lovely NHS long-term plan, which I'm sure you've all read, all 120 pages of it. Yeah, it's long, but it's an interesting document, and I call it 5+5. Why? 5 years of getting everything into place, followed by 5 years of measurable delivery of change. So let's go for the top liners. I said this earlier, I'm going to say it again. First ever investment in primary and community care. You have to make mileage out of that. First ever investment. The introduction of primary care networks through which integrated community and primary care will be delivered. This is an opportunity, and you have to find out what's happening locally. This is where groups of GP practices are coming together in populations of around 30 to 50,000, and within that there will be new roles emerging. Roles around social prescribing, clinical pharmacy, physician's assistants. In my opinion, it's got opportunity written all over it, and you have to get involved in that. Interestingly enough, comes the end of the commissioner-provider split and a shift to collaborative alliance working. This is a benefit. It may seem hard work for your bigwigs, as we talked about earlier, as they have to work more closely with each other. But actually, it's a benefit and it's an opportunity. Sitting above us all is this high-level integrated care system. and there'll only be one CCG per integrated care system. Goodbye, CCGs. What's the real big thing? The massive emphasis on prevention, early intervention, personalisation, and self-management. Absolutely plays into your area of care right now, and this is where you could really score. And let me not forget to add into this the digitisation of the way forward, the introduction of digital as a more important component in how we do our day-to-day work. So essentially the focus is better health. People need to keep themselves healthier for longer and not rely on the NHS. Prevention, early intervention. Better care. Once people get in the system and they really need care, then they need to get the best possible care. And lastly, best value. Using NHS resources in a better and wiser way to deliver much better measurable results, and the old phrase, the biggest bang for the buck. How do you make every pound work hard? And what does all this address? You've got it. Spiralling costs, not enough capacity to deliver, and increasing demand. So to summarise, 1, focus on your own organisation, not on your commissioners. 2, understand what's happening locally with primary care networks. 3, get a copy of your organisation's quality improvement plan, strategy, and see how an initiative you could come up with would fit into that. Develop your audacious idea on the back of that. And 4, think about motivational interviewing. It's a great technique. And last but by no means least, look out for my column on your website because it's coming soon. Have a great conference.